Hi, I'm Dr. Wright, and you are?
Brian.
Brian, nice to meet you. Today I'm going to be evaluating your spine from the base of your skull to about the belt line.
Okay.
At any point, I need to expose that skin of your back. Is that okay?
Yeah, that's fine.
Okay. While I check the table, would it be okay if you just took off your shirt?
Mm-hmm.
Okay. Go ahead and take off your shirt while I check the table. Okay. Brian, if I could have you face that way, seated down, I'm going to do a general scan of your spine. I'll locate the PSISs. Cut. After my general scan, I felt a little restriction in the upper thoracics. Now I'll be assessing a full evaluation of the right SI joint with the patient prone, flexion and extension. So Brian, could you please lay down on the bench, face down. I'll be standing on the left side of the patient. First, I will locate the right PSIS. I'll place my superior hand just medially to the PSIS, and I'll place my inferior hand. I'll locate the ASIS with my inferior hand. As I palpate the ASIS, the iliac ilium, anterior to posterior, I feel normal joint movement with a healthy resilience. For extension of the right SI joint, I can go ahead and keep my superior hand just medially to the PSIS. I can palpate from the S4 down to the sacral hiatus, and with my inferior hypothenar, I'll place that on the sacral hiatus, and I will palpate the sacral hiatus from posterior to anterior, and as the sacrum moves anterior to posterior past the PSIS, I can feel normal joint movement and healthy resilience in play. Okay. Next, I will be doing a complete evaluation of the L2, L3 segment in a seated position. So Brian, if I could have you get up and sit down on the edge of this bench facing this direction. To locate the L2 spinous process, I will bisect the iliac crest to the S4 spinous process. And from there, I'll palpate two spinous processes up to find the L2. Okay. From there, I'll slide my fingers down to the inner spinous spaces, and I will do a flexion and extension evaluation. So I flex the patient forward and extend, and as I flex and extend, I feel the spinous process's normal movement, separation. Okay. From there, I will go from the L2 spinous process, and with my thumb, I will move to the lateral aspect of the L2 spinous process, and as I spy on the L3 spinous process, I will rotate the patients to the left. And Brian, if I could have you put your arms across your chest. And as I rotate the patient to the left and feel for springiness from lateral to medial, I feel the spinous processes move apart. Next, I will laterally bend. Next, I will laterally bend the patient to the left to check for buckling of the joint. As I laterally bend the patient to the left, I feel the joints of the lumbar buckle away from me. And there we have normal joint feel and a healthy resilience. Next, I will be doing a complete evaluation of the T8, T9 segment with flexion, rotation, lateral bending, elevation, and depression of the 8th rib. So first, I will find the T8 spinous process by bisecting the lower edge of the scapula to the T7 spinous process. From there, I will palpate one spinous process down, inferior, and I will place my fingers in the inner spinous spaces to evaluate separation. I will flex the patient forward and back, and as I flex the patient forward, I feel separation between the spinous process, which is normal. From there, I will place my thumb on the lateral aspect of the T8 spinous process, and I will spy on the T9 spinous process. Now, Brian, if I could have you cross your arms over your chest as I do rotation of this segment. The T8 spinous process moves away from the T9 spinous process. And as I palpate lateral to medial, I feel the springiness in the joint, which is normal. Which is normal joint play with a healthy resilience. Okay. From there, I'll keep the same segmental contact point with my thumb on the lateral aspect of the T8 spinous process, spying on the T9 spinous process, and I will laterally bend the patient to the left, checking for buckling of the joint. And as I do this, I feel buckling of the joint, which is normal, and a healthy resilience. From this point, I will evaluate elevation and depression of the 8th rib. So first, I'll palpate superior from the T8 spinous process, superior to 2 inner spinous spaces. Next, I will palpate to the left laterally 1 inch to the transverse process, and from the transverse process I will palpate another 1 inch to the rib. And I'll place my thumb on the inferior border of the 8th rib. Now, Brian, if I could have you cross your arms over your chest. From here, I will rotate, lateral bend, and flex the patient to the right. And as I do that, I feel the separation of the 8th rib relative to the rib below. I will also rotate, lateral bend, and extend the patient to the left from the superior border of the 8th rib. And as I do that, I feel the closure of the rib above onto the 8th rib. And as I palpate inferior to superior on the inferior border, I feel a healthy resilience and in play. Thank you.